I'm Brent Campbell, and this is the brilliant Dr. David Asher, and we've been talking for a good hour about a number of things relating to health. And here I'm getting to talk with an expert, and it's doing me a lot of good, and I hope that you can watch some of what we're talking about here and learn from it as well. I had a series of revelations a couple months ago, and one of them was related to how I felt much of the time. And I guess as I've had more responsibility, I have to be more accountable. So I have to figure out why, if my energy is lagging or if I'm in a bad mood, why and what I can do to improve it if it's possible. And in many respects, I had accepted that, okay, well, we all have to deal with a little bit of depression from time to time, or at least most of us do. We have our good days, we have our bad days, we have our mood swings, it's normal. And, I'm supposed to eat right. I'm not supposed to eat the bad stuff. I'm supposed to sleep 8 hours a night. And, I'm sorry, but I'm not perfect. I try really hard to do all the right things, but it's hard. Life is hard.
Yep.
Sorry to break it to you, but it is. And it's hard for everybody. I was struggling with this, though, and I knew that surely there was something I could do to make things better. And I started to become a sponge for information. I read everything I could get my hands on regarding nutrition, and I started to become aware of concepts like clean eating and brain health and oxidative stress. But I didn't fully understand and fully apply all of the insights that were readily available to my life. The way that we approach health, at least traditionally, I think has been a mistake, because it sort of says, if you don't eat these things and you eat these things, you're going to be healthier. And I don't think that just doesn't resonate. I think if you frame it in the way of, not only are you going to be healthier, not only are you going to live better, you're going to be less likely to have disease, especially later in life. You can feel better tomorrow. You may not have the mood swings. You may not have depressive tendencies. You may not have energy lagging. I mean, if there's anything that gets me or that got me, was what I wanted to have was energy. I would sit in a meeting or I would meet somebody who had this charisma, this boundless energy, and I wanted to have that. I thought that if I had that, and probably rightly so, if I had that, I could just do better in all aspects of my life. And I realize now that that's diet and exercise and sleep as much as anything else. Why that didn't occur to me before then, I don't know, but I suspect I'm not alone. So I came to realize all these things, and I began to apply them systematically to my life. And the key, I think, is just to have health that radiates from the inside. It starts within. And, it's your brain as well as your body. So back to the nutritional aspect of it, something that I have very carefully applied to my life. I don't eat the wrong things except on rare occasions, and I prepare for them because I know that after I eat the ice cream, if I have the cookie, if I have the burger, the French fries, that I'm going to feel awful afterward. And now in retrospect, I realized that I always felt awful before because I was eating that junk. Now I'm like, well, if I don't have the French fries or the ice cream or the hot dog or the hamburger, it sure looks tasty, but I don't really want to feel awful afterward. I have a meeting I need to go to, or I want to be engaged with my kids today, or I've got to think through this problem with work. No, I can't sacrifice my energy just so I can have a tasty treat that stays in my mouth for 5 minutes. And not just taking out the bad stuff, but adding the good stuff in. You just need to eat right, and you need to sleep, and you need to not eat the wrong stuff. And if we all applied that, I shudder to think what a better world we would have. The good news is the information is getting out there. We're not the only ones who know this. The word is getting out. We have done the research, we have the science. we now are empowered to do these things. We now understand, and if we give ourselves the education, we won't have to have willpower to resist eating that junk. And, we won't have to twist our own arms to spend the 50% more to get the organic produce instead of the regular. And, we're going to look on the shelf and see broccoli and cauliflower and cucumbers and strawberries and blueberries and all the things that we're supposed to eat and get excited, and then look over at the processed foods over there and say, gross, I can't imagine doing that to myself. Because we've got to make the connection, and once we make the connection, it's no problem at all, because if I spend $10 on a salad instead of $1 on the Big Mac, whatever a Big Mac costs these days, I'm going to get a better return on that $10 than I'm going to get on that dollar. Not only because I won't be sick when I'm 60 and unable to walk, and I'll need to have round-the-clock health care, but because later on this afternoon, I'm going to feel great, and I'm going to be able to make my life happen.